In part 1 of this series, we explored next-gen ingredients, so exosomes, growth factors, peptides, and stem cell technology. Today, we're taking it a step further, professional treatments that can amplify those ingredients and take your results to the next level. Hi, I'm Karen Kelly, skin therapist, master educator, wellness enthusiast, and professional overthinker who decided to journal publicly. Every week on my blog, I explore everything from skin science and travel skincare to life mindset and the messy middle of finding your voice. This channel is where all of those thoughts come to life, so grab your tea, get comfortable, and let's talk about how professional treatments and advanced topicals can work together synergistically. Look, if you've watched part 1, you know that I absolutely love advanced skincare ingredients. Exosomes, growth factors, peptides, these are powerful tools that can deliver real results when used consistently at home. But when you pair these advanced topicals with professional treatments, something remarkable happens. The treatments create channels and stimulate deeper layers in your skin, while the advanced ingredients themselves, they provide the regenerative support that your skin needs to maximize that healing at home. So think of this way, your at-home next-gen ingredients work on the top layers of the skin or your epidermis, and that helps to support cellular communication, while professional treatments, they create controlled injury channels deeper into the skin, like in the dermis area where the collagen and the elastin lies. So together they address signs of aging and damage from multiple angles simultaneously. Disclaimer, I am not here to tell you that you need professional treatments. That's not my goal with this video. But if you are already investing in at-home products and wondering what else is possible, let's break it down together. So let's start with microneedling, probably the most accessible professional treatment there is out there, and one that works phenomenally with next-gen ingredients. So what is microneedling? Microneedling uses tiny needles to create controlled micro-injuries to the skin. I know. It sounds intense, but hear me out. When your skin experiences these micro-injuries, it kicks into healing mode. Your body starts producing fresh collagen and elastin, which are structural proteins that keep your skin firm and smooth. Essentially, you're tricking your skin to regenerate itself. What can microneedling treat? Well, it can treat texture issues, uneven skin tone, fine lines, mild scarring. It's particularly effective for those with deeper concerns that even advanced topicals can't quite fully address on their own. Downtime is minimal. We're talking 24 to 48 hours of redness and sensitivity. Most people can return to their normal day-to-day activities pretty quickly, although you might still want to avoid any intense heat exposure like saunas or steam rooms for at least the next few days. And here's why I really like microneedling. When it's done correctly, it works effectively across most skin tones. Unlike some lasers, there is a lot less risk of hyperpigmentation for melanin-rich skin, although you still need an experienced provider who understands your specific needs. And this is where these next-gen ingredients really shine. Your practitioner can apply medical-grade versions immediately after microneedling, when your skin has these microscopic channels that allow for deeper penetration. The treatment creates the pathway, and the advanced actives help to do the regenerative work. Now let's talk lasers. There are 3 main categories, and they operate very differently, so knowing which one you're getting really matters. Non-ablative lasers use heat to stimulate collagen production without removing any surface of the skin. So think of it as just warming the deeper layers to trigger regeneration from within. The benefit here is no downtime. You might have some mild redness right after, but you can usually go straight back to your day. Results are gentle and cumulative, meaning they build over a series of treatments. This is ideal if you want more of a gradual improvement without a lot of disruption in your day-to-day activities. Fractional lasers. These create controlled micro-injuries in a pattern across the skin, pretty similar to microneedling. It just uses laser energy to do it instead of needles. Downtime is moderate, usually about 3 to 5 days of redness and peeling, but the payoff is a lot more significant improvement in texture and tone. This is a middle ground option, more aggressive than non-ablative, but definitely not as intense as fully ablative. Fully ablative lasers remove the entire surface of the skin. It's the most aggressive option and requires serious downtime. We're talking 7 to 14 days of healing or more. But these give the most dramatic results. This is for deep wrinkles, severe scarring, or major sun damage. But fully ablative lasers do carry a higher risk for melanin-rich skin. Hyperpigmentation, scarring, these are real concerns. And so this option requires an extremely experienced provider who truly understands the needs of melanated skin. So when you're researching lasers, don't just ask, do you do laser treatments? Ask what type of laser, why they're recommending that type of laser for your specific service and your skin, and what the expected downtime and risks are of that procedure. So you might be getting that there are some risks associated with these advanced treatments if you have melanin-rich skin. So let's get into what you need to know. This section, non-negotiable. Melanin-rich skin behaves very uniquely when it comes to professional treatments. Our melanin is protective, but it also makes us a lot more susceptible to certain complications, specifically hyperpigmentation, scarring, and uneven skin tone. When these professional advanced treatments are done incorrectly, results can be worse than what you actually started with. And unlike a bad haircut, skin damage can take months, even years to correct, and in some cases, the damage can be permanent. Here's what makes melanin-rich skin really unique when it comes to the context of professional treatments. Post-inflammatory hyperpigmentation, that is our biggest risk. Any trauma to the skin, even controlled trauma like microneedling or lasers, can trigger excessive melanin production, leaving dark spots that are harder to treat than the original condition. Certain laser wavelengths can be absorbed by melanin in the skin surface, not just the target area, which might be below. And this is why fully ablative lasers carry such a high risk. The laser cannot distinguish between the melanin you want to keep and the pigment that you're trying to address. Because of this, conservative sessions are non-negotiable. You always want to start with a lower energy level and build up over multiple sessions. That is always safer than going in aggressive straight out the gate. This strategy is not about being overly cautious, but really protecting your skin's integrity. Super important. Your face is not the space for experiments. This is where you want to be selective, you want to ask the hard questions, and you want to walk away if something just does not feel right. Trust your instincts. If your provider makes you feel uncomfortable or you feel rushed into a decision, that's your nervous system telling you something very important. So how do you choose a provider? What do you need to know? The provider you choose matters just as much as the treatment itself. Here's what you should look for. First, a portfolio of results. You need to see before and afters of photos of skin tones similar to yours that are treating concerns similar to yours. You don't just want 1 or 2 examples, you want a consistent track record. Secondly, you want a transparent consultation. A good provider will walk you through exactly what they're planning to do, why they're recommending it, and what you can realistically expect from the series of treatments. Third, super important, you want to make sure that you see proper credentials and experience. For advanced treatments like lasers, you want to look for medical practitioners. So these can be MDs, dermatologists, plastic surgeons. Nurse practitioners can do them, as well as physician assistants that are under supervision. Licensed medical estheticians can perform certain treatments like microneedling, but you want to verify their scope within your location. And most importantly, credentials alone are not enough. You want to choose someone who has demonstrated experience with treating skin like yours, not just the right credentials with no proven track record on melanin-rich skin. Another thing that I would say to look for is customization. If they're using the same protocols and the same machine on everybody, that's a problem. Your skin, your concerns, your treatment plan. Fifth, in your conversations with them, they need to have some level of understanding of the Fitzpatrick and Lancer ethnicity scale. They should understand both. The Fitzpatrick scale talks about melanin and sensitivity, and the Lancer ethnicity scale, this gives a more nuanced classification that accounts for ethnic variations in skin's behavior. your provider should specifically ask you questions about your skin tone, your ethnic background, and your history in general. If they don't demonstrate familiarity with these two scales, that's a red flag. Talking about red flags, good segue. These are some things to look out for. Anyone who's overpromising results. If it sounds too good to be true, it probably is. Hyperpigmentation is incredibly difficult to treat. So if they are promising something very, very quickly, red flag. Any pressure tactics, any provider who's rushing you into decision, that's not the one. Genuine lack of experience with melanin-rich skin. This is not necessarily a fault of theirs, but it's just that if they cannot speak specifically to treating your skin tone, you don't want to be experiment, walk away. Any unwillingness to show patient results. If they're dodging this request, there's a reason for that. If anybody's dismissing your concern about hyperpigmentation or making you feel that you're being overly cautious by asking questions, walk away. Talking about questions, feel free to ask as many questions as you like in your consultation. That's why you're having a consultation. Some questions you can ask are, do you have any experience with treating this specific concern on my specific skin tone? Can I see before and after photos of patients with similar skin? What settings will you use, especially if you're using a laser or even microneedling, and why? What's your protocol in case complications arise? Do they have a plan built in? You can talk about the settings. Will they start with conservative settings and build up over time? And how does this look in terms of the number of treatments and the pricing? And just know that these are not aggressive questions. They are smart questions. And any provider worth their salt and their credentials will appreciate the fact that you are informed, you are intentional, and you are seeking the best for your skin. So expectations, what to expect, because unrealistic expectations is where all of the disappointment lives. The first couple weeks, this is your healing phase. You might have some redness, some peeling, some sensitivity depending on the treatment. This is absolutely normal. 4 to 6 weeks, I'd say this is where you'd see most visible changes. Your skin texture begins to smoothen out, your skin tone starts to even out, and fine lines start to soften. This is typically when friends and family might ask you if you've been on vacation. They might tell you that you look really rested. These changes are noticeable, but they're very natural looking. You just look more refreshed and radiant. About 3 to 4 months is when you see the full results. This is when the collagen remodeling is complete and you see the maximum benefit of your treatment. But for this timeline, you need multiple sessions. These are not one and done treatments. Microneedling requires typically about 3 to 6 sessions spaced out over 6 weeks. And then lasers, you might need about 2 to 4 sessions depending on what you're specifically treating. Maintenance with professional advanced treatments is part of the equation. Professional treatments definitely give you results, but maintaining them at home requires good skincare. And this is, yes, where exosomes, peptides, growth factors, all the things that we spoke about before, this is where this comes in and potentially really helps to elevate and accelerate the results that you're going to get. With this, you might potentially need touch-ups, so maybe 1 or 2 treatments a year. Now let's talk investments, because with what I just said there, you can imagine that these treatments aren't cheap and you deserve to know what you're paying for. Microneedling typically would be anywhere from $200 to $700 depending on 1, your location, 2, your provider credentials. Lasers, this can be anywhere from $300 to, $2,000 or more if you're doing a fully ablative procedure. What are you paying for here? Expertise, proper equipment, medical protocols, and safety. This is your face. Cutting corners here can cost you way more in the long run. So these treatments paired with topical applications, this is a long game. Results build over time, but when it's done right and with the right provider, using the right protocols for your skin and supported by at-home quality skincare, absolutely worth it. So in summary, professional skin treatments can be transformative when you're informed, intentional, and working with the right provider, especially if you have melanin-rich skin, where choosing the right provider and the protocols are essential. These treatments work best when it's paired with quality formulated at-home care, like some of the ingredients that we spoke about in part 1. I've linked the full blog post below where you can see all the specific questions, protocols, and details in written form. So it's screenshot friendly, very easy to reference. And if you found it helpful, give it a thumbs up, subscribe for more evidence-based skincare science. And drop a comment and let me know, are you considering or receiving these advanced professional treatments? Are you already using advanced ingredients at home? And if you made it all the way to the end, thank you so much. I appreciate you. And remember, if something doesn't feel right, even during your consultation, trust your instinct. Your face is not a place for experiments. Next week, we're diving into exosomes. This is definitely the most hyped and the most expensive advanced skincare ingredient right now. We'll cut through some of the marketing hype and understand the actual science of exosomes, also the science of exosomes in skincare, and whether they are worth the premium price. Until next time, stay radiant and be well.